Here we'll be treating greater trochanteric bursitis using shockwave. We're going to go to 2 bar, 12 Hz for 2000 shocks. We're using a 15mm convex head. You could use the deep impact concave head for this treatment, depending on how deep in you think the bursa is. In this case it's fairly superficial, so we're going to go with the convex head. I'm just going to put some gel onto the patient. It's quite important you actually identify where the bursa is. So you might have to just palpate a little bit to find the bursa first of all. They're not necessarily immediately apparent. Even really swollen bursas often don't appear on the surface of the skin. You just can't see them. Apply some gel to the spot. You may have to come back on with your finger just to find the right spot to put the treatment into. And then we're just going to put the shockwave straight down through and into the bursa. It's fairly common in this treatment to actually angle the shockwave so that it goes and hits the bursa at various different angles. I would stay away from high pressures with greater trochanteric bursa. With some of the smaller bursas, like the bursas in the foot or the hand, you might actually try and burst the bursa. That might be a goal, and so you'd go for a higher pressure and try and actually burst the bursa. We're not trying to do that here. We're trying to decrease the size and the inflammation in the bursa. We're trying to get a healing response rather than trying to burst it. So we angle the treatment head, go through the bursa at various different angles, try and hit it from all sides. You'll see I'm just moving the treatment head around here until we get the right position to cover all the different angles. And we continue that for 2000 shocks.